Thank you for joining us today as we sit down with our favorite physician and two moms that are going to share their experience with vaccinating their children. Our focus for today will strictly be for moms sharing their story and the challenges and their desires to move forward with vaccinating their kids. We'll also have Dr. Poole share pertinent information regarding the safety of vaccinations for kids ages 5 through 17. So without further ado, I'm going to introduce our panel. We have Dr. Renee Poole. We have Mrs. Tennille and Mrs. Bridget. And then my name is Alicia, and I am the CEO of AHN Foundation. And Dr. Poole is also the interim president of Association of Black Women's Physicians. So thank you, ladies, for coming and joining us today. So Dr. Poole, I want to start off with confirming the eligibility for vaccination for kids. What's the age of eligibility?
Well, thank you for having me and having this such an important topic to discuss. We want to make sure that everyone is aware that our children are now eligible to receive the COVID vaccine, 5 and up. So please make sure that you are aware that your child, 5 and up, can receive the COVID vaccine that is provided by Pfizer.
Thank you for that. That's good to know. Now, for Moderna, it's ages. What are the ages for Moderna?
Yeah, so Moderna is 18 and up.
Okay.
So there has been any emergency authorization or full approval for Moderna to lower their age. Only Pfizer. So from 5 to 11, Pfizer did receive an emergency authorization for the vaccination, and 16 and up, full authorization to move forward.
Perfect. Thank you. Because I know people have questions about that, because I hear a lot. It's so confusing. It's so confusing. And I totally understand working in this space. It's not confusing per se, but it can become overwhelming with the amount of information that is readily available to us. So thank you for clarifying that. Before I go any further, I do want to confirm that those of us in the studio are wearing masks because we do not know our status regarding COVID-19. And so we want to make sure that we protect ourselves and protect others. Dr. Poole is off-site, so she's in a secure room by herself, so you will see her complete face. Thank you. So the one thing I hear a lot is, I don't know if this vaccine is safe. Will my daughter be able to have children? Will my son be able to make babies with his wife or with his girlfriend or whomever? That is the constant conversation that we hear. We also hear about myocarditis, blood clots, all of these different adverse effects. We hear them hodgepodge together for the kids. So you and I, we talk about this and we're able to break things down in a clear and concise way. So can you share with our viewers what that looks like, the safety of this vaccine for our children?
So the concern is there because of how the information has been shared. There is a lot of confusion. And so we'll do our best to try to clarify that this afternoon. So the vaccines are safe. There have been clinical trials with thousands of children to ensure that the vaccine is safe for rollout for everyone. So there has been no reports of any adverse effects, serious side effects from the COVID-19 vaccine. And there has also been no indicator that it affects male or female fertility, ability to have children. It doesn't affect developmental stages, including puberty, and it doesn't affect, long-term medical problems, organ damage, etc. So these vaccines have been proven to be safe and effective, but the safety concern is there. I totally understand, but rest assured, trusting science, these clinical trials have proven that they are indeed safe. Now, I do know that there's been word about the myocarditis and the pericarditis, inflammation around the heart and the fluid around the heart. when it comes to the Pfizer vaccine. That absolutely was seen, but be it clear that they were seen in very small cases in adolescent males, not in large numbers. So very few numbers. And when anything adverse happens like that, absolutely it's going to be shared, it's going to be amplified, but it was not the majority at all. It was a very small number of cases where that took place. So generally speaking, these vaccines are very safe for your healthy child and even for your child who may have underlying medical conditions. And there is no foreseen complications in the long run either when it comes to their health and development.
So glad that you shared that. And one thing I want to make sure that we make clear, so side effects are chills, headaches, little nausea, you're sleepy, extra tired. Those are side effects. Adverse effects are things that may, or experiences like the myocarditis, diagnoses that may be diagnosed by a physician. What they're finding though is it's reversible. And that's something that people forget to say. Those that have had adverse effects, their adverse effects have been reversible. Now, I'm not going to make a blanket statement and say 100%, but we will say the majority have been able to continue with life as normal. And one more thing, it seems to me, and you tell me your thoughts, the thing that parents specifically, which I totally understand, are most concerned about with the vaccine, it's actually the thing they should be concerned about with their child contracting the virus and developing the disease that is COVID-19. Because we've seen where there have been issues with reproduction. We've seen that there have been long-lasting side effects, health effects, from COVID-19, like COVID long haul, even in little children, rashes and lack of activity, exhaustion for months on end. So do you feel the same way?
I do. And, I want to unpack a little bit of what you shared thus far, when it comes to side effects. Side effects of the vaccine with children are comparable to what we see with adults. Okay. And these side effects are temporary. And these side effects are a sign that you have a healthy immune system. That's your immune response to the vaccine. So common side effects would be site injection tenderness and soreness, more localized reaction. More of a systemic side effect would be the fatigue and the brain fog and the chills and the low grade temp. But it's very temporary, lasting 1 to 2 days that you can care for with supportive care, plenty of fluids, rest, Tylenol, etc. That is completely separate and completely understandable too, because that's your immune response versus severe adverse events that are more permanent and life-threatening. So we have to tease out the two and just understand that two different things. To the other point of the concern of vaccine administration versus getting COVID itself, the reason why we vaccinate is to reduce the risk of these complications, hospitalization, and potential death. So we have to really look at the risk versus the benefits. The reason why we vaccinate against all the ones we provide vaccination for is because we know of the long-term implications of that infection, including hospitalization and death. And there's a way to reduce that risk. And children absolutely are at risk for such complications short-term during the infection, short-term after you're no longer infectious, and long-term. And those are your long haulers. And we're seeing chronic fatigue, body aches and pains, issues with learning. And children also are at risk for what is called a multi-system inflammatory disease, where it could affect all the different organs from the brain to the liver to the digestive system to the skin, way after a COVID infection. So if we look at the risk that we are putting our children in for getting COVID and the potential complications versus the benefits of protecting them with safety precautions and the vaccine, we absolutely encourage vaccination.
Yes, and I'm so glad that we were able to really drill that down because one of the things that I hear a lot are kids don't get sick from COVID, and a lot of people are discussing the wild type. That's just the alpha variant, the very first variant of SARS-CoV-2, which is the virus that causes COVID-19. But we would hear, oh, kids don't get sick, kids are fine. And we saw in the wintertime of 2021, going into 2022, kids were not fine. And one of the things that baffles my mind as a mom and just as a human, we've always concerned ourselves about our children. We've always said, you know what, we need to do whatever we need to do to keep our kids healthy. Vaccinate the babies. Make sure the babies are going to the doctor every 3 months for their first year of life. And then as they get older, it tapers off. But we want to make sure we keep our kids safe. And so the statements of, oh, well, our kids are going to be fine. Our kids are going to be fine. Kids don't really get sick. Well, I feel like one kid lost is one too many when we can prevent that life from being lost. So thank you for sharing that. I kind of want to shift a little bit because, as you see, we're here wearing our masks, and the state has lifted the mask mandate. Now, I'm going to say this. I understand public health holistically. I get it. I get why the mask mandate was removed. I'm not against it. I am pro personal choice, and personal choice meaning I want to make sure that I'm safe. And so that's why I still wear my mask. That's why my husband still wears his mask and our girls still wear their masks to school. What are your thoughts about the mask and kids wearing their masks in school?
Yeah, well, I totally agree with you. Mandate or not, ultimately you have to make the best decision for you and your family and what you would deem the most safest to keep yourselves healthy. But just kind of remember to put it in context of for our children. Our children don't really know how to social distance. They play together, they eat together, they share everything. There's the issue of the small classroom, with up to 30 kids in one classroom in closed quarters. There's the issue of even hygiene, particularly with our younger children, not washing their hands frequently, etc. And they're the lowest group of low vaccination rates right now, which is why we really want to encourage more vaccination rates within our kids. So they're vulnerable to getting COVID. And themselves being vulnerable to getting COVID can increase the risk of their household members in getting COVID. And so it's the vicious cycle of highest risk for exposure and of getting the infection and potentially passing it on to others. So, please consider that when you make your decision in having your children wear their mask, continuing to wear their mask or not. They're in a little bit of a higher risk group. Because of the low vaccination rates and because of the environment and because of the social constructs of being a child, and then consider the other family members.
Absolutely. Kids, they share germs. They've been sharing germs since they were infants. You take your kid to daycare. What's the first thing the doctor tells you? Be prepared. Little Kenya is going to get sick. She's okay. She's around fresh new germs and kids in each other's faces and playing and talking and high schoolers doing what high schoolers do and middle schoolers doing what middle schoolers do and all that good stuff. So for me, in my house, we will wear masks. I know my 17-year-old has asked me, do you think we'll be wearing masks in the summer? And so I told her, I said, well, I want to rewind back to summer of 2021. When we thought we were in a good space, and then the Delta variant came in and reminded us that we needed to remain humble. And so that's my encouragement to those that are watching, to remain humble as we process through this because we're still going through it. We're not out of it yet. It may seem like it, but we are not. So Dr. Poole, please hang out for a sec. I'm gonna shift and ask a few questions to our parents, and please feel free to share your wealth of knowledge. Ladies, thank you for joining us today. So before we get started, Tennille, if you could share with me the age of your children.
Yeah, thank you for having me.
You're welcome.
I am a mom of 3. I have a 16-year-old daughter, a 14-year-old son, and a 7-year-old daughter as well.
Cutie patootie too, she is. Not that the others aren't, but I just love the little ones. Miss Bridget.
Thank you for having me
You're
as well,
welcome.
Alicia. I appreciate the opportunity to be here and share. I have one daughter, Alexis. She's just turned 17 on the 12th. Yes, thank you.
You're welcome. Okay, so now we have the ages, and I'm going to share. I have kids too, okay? I have 3 daughters. Their ages 19, 17, and 16. I say that slowly because I have to make sure that I remember their ages correctly. So let's go to the deep side of the pool. Were you ladies afraid of getting your kids vaccinated?
I was absolutely terrified, actually, of having my daughter vaccinated. I was really concerned about long-term adverse effects, infertility, cognitive decline. Would her body then reduce its ability to have a natural immunity? So those were amongst my deepest concerns. And selecting the actual vaccine, I was adamantly against Johnson & Johnson for various reasons and was not secure in believing Moderna would be a good choice. And so I thought hopefully Pfizer comes through with something that she could take. And fortunately, that was the one that was approved.
Yes.
So.
Yes, absolutely. Right along with Miss Bridget, definitely probably afraid of putting something into my kid's body that I had no idea of. And even as the information was coming to what you alluded to earlier, it was just overwhelming, and it was so much, and it would change consistently. And I think ultimately for me, one of the main reasons was the medical community just hasn't been good to our people. And so I had to really, take a step back and really go, okay, I got to really make sure I'm getting good information and accurate information so that I can make a really good choice for my children. But that was the main thing at the forefront. That the fact that the medical community hasn't been really great to African American people. And then as well, just our culture has changed where we're really quick. Everything is fast, and now we have that fast food mentality. And so I also felt like this seemed too quick. Like we now have a vaccine all of a sudden. And so, of course, after doing the research and learning and understanding that this had been started and developed with SARS and with MERS, and understanding that and going, oh, they've been working on this for a while. Okay, this is not anything new. That really helped me to change my mind.
You bring up like all the points, literally all the points that plague so many people, specifically Black people, right? And vaccination and medical mistrust, not distrust, because the mistrust was earned, okay? So you bring up all the points, and Dr. Poole and I talk about this a lot in our conversations that we have about what has happened. And we also talk about the evolution of science and the evolution of public health. And that's what we are living that out right now in real life. I don't know, Dr. Poole, I want to bring you back in real quick. So Tennille brought up a great point about the mistrust in the medical system not being good. The thing though, for me, because I agree with her, the thing that bothers me is, okay, we have issues with the medical system, but yet we'll trust our cousin, sister's, uncle's brother that got something off of YouTube from someone that may have graduated from high school with a 2.0 average, never went to college and didn't study medicine. I don't understand that. Like, which one is it? You don't want to trust Black physicians, Black public health professionals, Black scientists, but you want to trust someone that is like 5th removed in the family and got their information on a YouTube page that's now banned in the US. What's up with that?
I know it sounds crazy, right? The reality of it, right? We're more comfortable with what we know, you know. Unfortunately, because of the centuries of mistrust and mistreatment of Blacks in this country in the medical community, that has been ingrained, in our thought process, and it continues. It may not be as egregious as it was in the past, but there still is health inequities for a reason. There is still implicit bias that needs to be addressed, and some individuals don't have access to Black doctors and Black public health officials like ourselves, provide insight, perspective, to be available to even answer the questions, right? So representation is so important. And this is why I know we've partnered, over the last 2 years in creating a safe space to answer those questions, because that often is not found, generally speaking. So it kind of makes sense that individuals would perhaps, lean towards the cousin who, supports this and so forth, because they may not have access to really, more legitimate information. There are a lot of conspiracy theories out there. I feel like we've heard it all with regards to that. And unfortunately, because the vaccine was rolled out very quickly, it created a lot of chaos and confusion. And we did have to educate the community and say, oh no, we've been working on this for a good 2 decades. It's just the virus that's new, and we had to really hone in on that narrative, but understandably so. Unfortunately, we've had a lot of mistreatment, and we continue to be mistreated in the medical community.
Absolutely, and I'm so glad that you drilled it down like that. I also do believe, though, that the YouTube ministry has really affected our community, because there are videos on YouTube that give accurate information, and you do have to choose to want to go to those spaces. Specifically, Los Angeles County Department of Public Health, all the other departments of public health that are within the various states, they're always doing talks, always doing talks. You have individuals like us that are doing talks. The talks are there. We have to intentionally seek them out. And I do think it's easier to get false information and false information that is planted to harm us. And there has to definitely be awareness put on that. And there also has to be some sort of individual responsibility to do your best to seek out the truth. And if you're seeing that people are not dying after getting this vaccine, to continue to say that people are going to die after getting this vaccine is really harming our community. And I wish that it would stop. I really, really do.
And this is the unintended consequences of social media, not just YouTube, all over.
Yeah.
So, right, how information is shared from unreliable sources, how it's shared, when it's shared instantly. This is one of the major issues that we have with social media: overexposure, and it gives people a platform to share their opinions and share information without it being fact checked. And so there's been major problems created as a result of that.
And going back to our kids, they're on these sites, right? We have to make sure that we guard them or let them know this is fake. I have told my kids over and over again, that looks dubbed, or that looks fake, or this is not true, because people want to get into their minds. And, in the state of California, they can make a decision at the age of 12 regarding this vaccine, and they could say no or they could say yes. And so we have to make sure that they have the right information so they say yes. That's the goal. Shifting back to our moms. So you have one daughter, she's vaccinated, correct?
Yes, absolutely.
And then you have 3 kids. Are all 3 of your kids vaccinated?
They are not. My youngest one is not vaccinated. Once the vaccination became available for her age group, again, she has a lowered immune system. So we were still making a decision as should we not, what should we do? Once we had finally come to a decision to vaccinate her, she then caught COVID. And it was mild, and we had, fortunately, if in the words of COVID, a good experience, if you will. If she was only sick for a day, but obviously we kept her out. We kept her out of school. She was bouncing off the walls. I'm like, are you really sick? But nonetheless, so after that, and this was recent, and we thought, again, with misinformation, we thought we had to wait 30, 60, 90 days until we could vaccinate her again. And it wasn't until recently when I spoke with you that you said, no, that's not true. And so we've made her an appointment. We are adamant that she has to get the vaccine, so we're ready to go.
I'm glad to hear that. And just for our viewers, always consult your physician. There is a standard through CDC where you do no longer have to wait the 90 days. That was the standard when we had an issue with scarcity, meaning there was not enough vaccine to vaccinate the population. And we knew that people that tested positive perhaps had enough antibodies to keep from contracting the virus again. That has since been, I don't want to say changed because it's not changed, evolved to the current standard of care. And so I'm not going to go deep into that. I just say talk to your physician or talk to someone through the California Department of Public Health.
Out something too, since we're talking about that. Before, as things were evolving, things do change and get updated, right? We also were informed that you had to wait in between vaccines. Okay. That was the other thing as well, and that is no longer the case. You do not have to wait a minimum of the 2 weeks that we were previously following to have vaccine. In fact, you can have it at the same time as any other vaccine, and not be concerned about having its full effectiveness. And then also be concerned with increased risk of side effects as well. The side effects are the same that are noticed as a solo vaccine versus combined with others.
Absolutely. And when you make your appointment through myturn.ca.gov, you can schedule both of your appointments at the same time. If you do not go to your clinician's office, you can schedule those appointments at your local pharmacy. Let me ask y'all a question. What made you change your mind?
Well, initially, I had spoken with my father who lives in New York. He's in his 70s, and him and his wife were vaccinated at the earliest point. So when the vaccine was initially available, they went and were vaccinated, and he had spoke with me and he said, we got the vaccination, we're fine. The only thing we had was slight tenderness at the injection site. And I still was not convinced. And I said, I still want to wait 6 months to a year to see, if is dad going to fall out one day, or is, he's going to open his mouth, his teeth fall out, or, just, I wasn't sure. And so it turned around in my mind for quite some time. And I was one of those people that was listening to some of the conspiracy theories because of the distrust with the abuse and mishandling with Black people of color and the medical industry. And fortunately, I am a frequent, I frequently go to the concerned, by the coalition of involved African-American parent meetings, which to me is a safe space for essential information for my family. And Alicia actually did a presentation. And what I appreciated about her presentation is that she spoke in layman terms. She was not condescending. She addressed the conspiracy theories. And I just felt like her science-backed data and information and the way she conveyed the information struck a chord with me. And I felt like, do I want to be the person who, after receiving something that I could feel and receive, not just hear, and still continue to go on and be in denial, and my family gets sick and we end up dead or in a long-term adverse effect cycle where we can't recover? And then I thought about my daughter. I have one child, my biggest responsibility and my greatest accomplishment. And she's very involved at her school. So she's around kids all the time, not just during school hours, but after school. She's got a lot of activities. Do I really want her to be at risk? And how would I feel if we didn't get a vaccine, got really sick, or one of us died, or anything else that came with it? And I had to weigh my common sense with what, and normally in our people of colors mindset, we can't trust, don't do it. I had to weigh the options, and I really do credit Alicia's presentation because I felt like that was the first time someone spoke to me and I received it. So I think access is important, a safe space to receive it, a credible person, and someone who you can relate to. So a lot of times, I think initially we were getting the information from people who didn't look like us and who we did not feel had any vested interest in our good outcome. And I felt that from Alicia, and I credit her and I tell her, I know I sent her an email after that meeting and told her I really appreciated her presentation because I was absolutely against it. But it was just something that resonated with the way she presented the information, just her presence. It's important. So it's not just the facts, it's who's presenting and how they present to you. So I do credit
Thank
you,
you.
Alicia,
I
for
appreciate that.
I
No,
feel like it changed my family's life. I really
oh my
do.
God, thank you.
You're welcome.
That's powerful. Very
Yeah.
powerful. There were several reasons why we changed our mind. I think even initially with that fear, we just don't live our life in fear. There's so many things out there. And we knew at some point in stage we were all going to get vaccinated. It was just a matter of when. And we wanted to make sure that we had done our due diligence. We actually have family members, my brother and sister-in-law are both in the medical field, and they would consistently talk to us about the vaccine. And so we had that access to people who look like us that work in that field. And so I just wanted to make sure that all of the information lined up. So here I have family that's in the medical field and they're telling me something. And I as well attended a workshop that Alicia led. She's telling me the same thing. And, I'm getting the information and reading it and it all lined up. And I was like, okay, it makes sense. And so once for us, we were fortunate enough to work from home and do school from home. So there also wasn't a necessity in our case because we were staying in our little pod and we felt like there was no need for it. But the moment we had decided the kids were going to go back to school, we felt like it was our due diligence. Like we couldn't live with the fact that even if we were asymptomatic, giving that to someone else or even having our kids get it, it was really a decision that we were like, okay, this is time for them to receive the vaccine, especially because they're going to be out in the public with other people.
That's awesome. First of all, I did not pay them.
No,
she
did
didn't.
not.
She didn't.
She did not.
Make sure that's clear. And I really appreciate your kind words. Dr. Poole and I started in March of 2021 doing webinars. And we just did one this week, and we might do one more. I said we would, but I don't know. We'll see. I think this is a webinar that will keep playing on loop with individuals that are able to share their story, right? It's for me, I can read something and get enough knowledge, but for other people, they need to know someone else's experience, right? Mm-hmm. So you sharing your experiences and being very transparent is important to the community. One of the things in social work practice that we talk about is storytelling and how important storytelling is. And in the Black community, storytelling is super important. I want to know what your experience was with that doctor before I go see that doctor, or at that restaurant, or wherever we go. Before I do something to myself, I need to know what you experienced. So you all sharing your experiences are really powerful for other people. I will say this, vaccinating our daughters for me was not challenging. What was challenging for me was letting them out of the house without vaccine. That for me. My husband and I traveled once unvaccinated. We traveled again vaccinated. I remember that when we traveled the first time unvaccinated, in my mind I was like, we brought COVID home to these kids. Neither one of us were sick. But in my mind, we were all sick. Both of us were sick. Our kids are gonna get COVID. It was a wrap, right? And so I was like, I can't travel again without getting vaccinated. So he and I got vaccinated. Then the girls got vaccinated. And then they got their boosters because we knew. Now, our oldest kept begging for the booster before she was eligible. She was like, I want the booster because I'm in college. And so it was important for her. But I credit part of that is because I definitely was on a loop with information. It goes back to having access to information. And when you don't have access to information, it becomes very challenging for you to make a decision for your kids. You're not going to be forced to make a decision for your kids if you don't have accurate information that you agree with 110% bar none, full stop. And so my kids are privileged in that space. But for other people's children that are not privileged to have it on a loop, that's why I wanted to do this today. So I thank you, ladies, and I thank you, Dr. Poole, for agreeing to do that. I have a question for y'all, because you answered one of my questions already, so I have another question. We're going to go back to mask wearing. What are your thoughts? In school specifically, because I think that's people's biggest concern is school, because like Dr. Poole was saying, school, although we like to think it's a controlled environment, it really is not. I mean, let's be real. As much as we want it to be, you have hundreds of kids that are pretty much free. They're free. They're in a space where it's controlled for their safety, their physical safety. But when it comes to COVID or SARS-CoV-2, COVID-19, when it comes to that, it's challenging if they don't have their mask on. It's not a controlled environment then. It's not. So what about you all? What do you do for your students, for your kids?
Well, I'm kind of ambivalent about it. I feel like it is important. My daughter is avid about wearing her mask. She wears her mask. She does not care what the guidelines are. If it's been lifted or not, she's going to have her mask on. I feel like it's just as important to have the right mask as it is just to have a mask. So that's important. But I feel like similar to you, personal choice is very important. So if you decide that you're not going to wear a mask, respect people's space. Respect people's space. If you're not going to wear your mask, give that extra distance. Don't be so close. And if we all kind of spit a little bit when we speak, so give it a little extra distance and just be respectful of people's right to choose. And if you feel like someone is kind of a little bit too close, just be respectful in how you ask them, well, because I'm more cautious and I do prefer a mask since you're not wearing a mask, if you don't mind giving me just a little extra space. I think having a little bit of compassion about people's differences is important. But yes, I wear my mask, but sometimes it gets hot. So sometimes I do want to take it off. But if my mask is off, I am a little bit more aware of personal space and ensuring that I'm not all up in your personal space speaking to you. I'm hoping I'm making the right decision if my mask is off, but primarily I keep a mask in my purse.
Yeah, I would agree. I think that it's important for people to have their personal choice. However, for me and my household, as you put it out there, we will wear our mask. My oldest daughter, she's 16, and we try to give our teens a little bit of freedom, obviously. She has decided, like, if I'm out in the open and I'm distancing well, she doesn't want to necessarily wear it. But in the classroom, in close quarters, she's definitely has it on. My son, we were at an event, and he was eating like through his mask. I was like, is that how you eat at school? He's like, I don't take my mask off for anything. Like, he does not play. He is like, no, this is going to stay on. And then for my youngest, because I have to make the decision for her, as Dr. Poole has said, she's in the elementary school. So they touch and everything. And I have told her, you have to keep your mask on, even though some of her friends, she's like, well, my friends have said that we don't have to wear them. And I said, that's okay for your friends, but for you, you have to keep yours on. She's like, okay, Mom, I'll keep it on. So she's really good about keeping hers on as well, even with the peer pressure, if you will. And I don't think they're pressuring her, but just the fact that they don't have it on, she's okay with, you know what, this is what we're going to do.
And see, that's so awesome. I've already said that how I feel about it. I agree. If you choose not to wear a mask, that's your decision, and that's okay. If I choose, and my kids and my husband and I, we choose to wear our mask, it's okay. It's not a bad thing, because that's our choice, and it's what gives us comfort. I can tell you this, I really, I struggle, and I struggle with getting back to a sense of normalcy. I struggle very hard. And so that's why I do what I do, because for our community, for the Black community specifically, I really want us to do what we need to do to protect our community. Like, full stop, unapologetically. That is what I want. That's my desire, that's my wish. I feel like that's my life's mission right now. But for me, I'm having a hard time getting back to a sense of normalcy. So wearing my mask makes me comfortable. Now, we have these masks on for the sense of recording. Generally, I wear KN95 out in public. I don't wear N95 because I can't breathe in that one. But the KN95 has the nice beak, so I feel comfortable, and my lipstick doesn't get too messed up. And because I have lipstick on underneath this mask, just so you know.
Ditto.
So for me, that's what makes me feel comfortable. So I thank you, ladies. I thank you. Does anyone have any closing remarks that they want to make before we end our talk?
All right. So thank you to the moms to sharing their stories and their evolution and their thought process in protecting their children. As a family physician, I always like to make sure that my closing remarks include not only encouraging vaccination, but also reintegrate into your medical care. This pandemic has delayed your physicals, your mammograms, other vaccines, your PAPs, colon cancer screening, etc., because of decreased access, because of fear, etc. So please reintegrate into care for all family members to make sure that you're getting the health services that you need to stay healthy in general, but also, of course, stay healthy and reduce your risk of getting COVID by getting vaccinated and taking necessary safety precautions.
Moms?
Thank you. Thank you for having us.
No, thank you for coming and sharing your story, because one thing that we do a lot is keep our stories in our bubble, in our pod, in our brain, in our circle. We don't share for fear of misunderstanding, judgment, what have you. And this is a safe space for those viewing. No judgment here. No judgment whatsoever.
Yes, I also like to say thank you to both Dr. Poole and you, Alicia. I think more round tables or square tables, L table talks like this are necessary, and they need to be accessible after the fact. And so I appreciate the opportunity to come and speak, and absolutely thank you, because I do believe we did end up getting COVID over winter break, but it was, as you said, extremely mild, and I don't feel any long-term side effects or anything. And I believe that had we not been vaccinated, it would have definitely went left.
Absolutely.
So
I remember talking to you after, and I could still hear. I don't hear it.
Yeah.
I don't hear anything. Clear as a whistle.
Clear as a whistle.
Perfect.
So I credit you with
No.
no.
Thank you.
Take your flowers.
Okay.
All right.
Okay, I'll take them.
All right.
But thank you, ladies. I really appreciate you for coming, and thank you for watching.